Hi everybody and welcome back. This is the official last webinar in the series Navigating My Aged Care, and I have to say I think we've been really successful and helped many a person out there, whether they be provider, worker, consumer, family member. It's been really great. We have some amazing panellists here. To my left, Craig Gear, he's the OPAN CEO.
Morning.
Morning. Pat Joyce, she works for Seniors' Rights Service, an advocacy service network here in New South Wales. Thanks, Pat.
Good morning.
And Alison McCann. Alison McCann is the Assistant Secretary, Aged Care Access Branch at the Department of Health. And thank you very much for being with us, Alison.
Thanks, Marie. Good morning.
Morning. So we've had the first series this morning talking about managing your aged care services and reassessing them, but now we're going to be talking about quality in aged care, and particularly the Charter of Aged Care Rights and the Quality Aged Care Standards. And it's a nice way to wrap it up, I think, and give you the voice to actually manage, I think, and empower you in your aged care services. There are many providers out there that do an amazing job, and workers as well. So I wanted to acknowledge that in this particular climate. So when we're looking at choosing a service and we're looking at quality aged care, what actually, I guess, does that mean to you, Craig? You know, what is quality in aged care?
That's the $1 million question, I think, at the moment. What is quality and safety? And the Royal Commission is looking into that as well. But I think for me, it's one that actually focuses on the individual as a person, and it looks at the relationship that the person has with the provider and with the staff, and looks at making sure that that's balanced.
Yep.
So it's very easy to, when you're receiving services and supports, to actually be in a differential power relationship, and it's easy for providers inadvertently to be having power over an older person, and the older person feeling disempowered. So I think a quality service is one that tries to balance that and plans everything they do around that individual's need, what they want, what it looks like for them, and takes that time to do that.
Excellent, thank you. Now, as well, on the My Aged Care website, there is a great page that looks at what is quality in aged care, and it's beautifully written. It's quite easy to understand. And Alison, it has some links, doesn't it, as well?
Yes, that's right. So the new My Aged Care website is set up to enable you to find information from a variety of locations. The links on the website will go to the Charter of Rights. They'll go to advocacy groups like the OPAN network. And there's a whole range of documents you can print out, essentially, that provide information at the touch of a button. So probably the easiest link to go to is at the end of the page under resources.
Okay.
It has a myriad of information in it.
Great, thank you. And as Mark said, the website's now really easy to utilise, from the last session, so that's great. Good. So the aged care quality standards, I'm going to go to yourselves, Pat and Craig. What are these? What are aged care quality standards? And we touched on, about 3 webinars ago, accreditation. So either of you want to chat a little bit about those? Pat?
So yes, under the Aged Care Act there are a set of standards, and the new ones came out on the 1st of July, as with the new Charter of Aged Care Rights, and they dovetail together.
Okay.
So one supports the other, the rights and the choices. It's all about the individual. So they tee up very well, from governance all the way to seeing the person as an individual and having their diversity and individuality supported as well as acknowledged. So I think they're stronger than the previous standards, and that's what providers will be accredited on ongoing.
Okay.
We'll talk about timelines later, but the new charter is across all services: home care, home support, residential care, flexible aged care. So it's one charter instead of juggling 4, and it's getting a lot of attention. There's lots of deep exploration in there for the provider, and as well as the person saying, I'm the consumer. What do I want, and what are my values? And Mrs. McCare and myself it can help me make these decisions.
Beautiful.
For me, the Charter of Aged Care Rights is like this shield that is holding up to protect older people. And you think, oh, why do we need that? Well, sometimes you don't sort of understand your rights until they start to get infringed on. I suppose this is the shield to protect people when that might happen, to say, these are my expectations that I want from you as a provider, from the aged care system, and you've got the right to be treated that's the expectation as an Australian citizen to get those things. The quality standards are sort of the provider view of that, which starts to talk around same sort of thing, and the great thing is the same language. From the consumer point of view, this is what I expect from planning. This is what I expect from activities of daily living. This is what good governance looks like, and this is what a good feedback system looks like. So it's a very different way of framing that we've had in the past, and bringing those two things together.
Beautiful.
We call it the glove.
The hand in glove. Yes. So for the people out there that don't know anything about either of these two, there are there's quality standards that have the consumer at the centre, and there are a whole lot of frameworks of areas that need to be met, such as governance, clinical care, personal care, etc. And then there are the Charter of Aged Care Rights. Now these are 14 rights, very beautifully but powerfully written, and available in the booklet from the department as well on page 1. And that's a really good booklet as well. It goes through some of those, the rights, and it gives anecdotal case studies. I know there's one on me, who's in Commonwealth Home Support Program, utilising multiple providers. So they go across all aged care services, these rights, the Charter, don't they?
Absolutely.
Yeah.
There used to be ones that would sit, depending on where it's slightly nuanced, depending on where you were receiving your care. There's now the single Charter of Aged Care Rights, so that people understand that no matter where they're receiving their aged care, their rights are the same, and they're entitled to be treated in a certain way and expect
dignity
certain
and respect.
things.
Yeah, high quality and safe care, independence.
Taking risks.
Yeah, so they're really good to reflect upon. I think if we reflect upon those rights and our human rights on a daily basis, it really gives us a holistic picture of what it is that we want when we're ageing positively. Yep. Now we've got a few messages in the last session that I didn't address, because I feel that this is more appropriate that we give you the time, and that's to Don and Steve. So Don asks, because we're talking about rights and the Charter and advocacy, Don is asking, what do I do if I'm scared that there will be reprisal from my provider should I make a complaint? Now Craig, I'm going to go to you with this one first. And in fact, Steve also says, I would like to access an advocate, but fear this may make things worse. So both Don and Steve have got similar issues.
Yeah, I reflect on this, and I think this is about the challenges of trust in the system and in the aged care system at the moment, and that it's been a bit beaten.
Yep.
For some good reasons, that there's some providers out there that do need to improve. And there are others that just, I suppose, in the wake of this as well. And so there is the need, I think, for people to feel confident that they can speak up. We know that between 4 and 8% of people will actually take a complaint through to a formal complaint mechanism based on some UK evidence.
Okay.
So that's not a lot of people.
No.
And the sort of reasons they're saying, 57% saying, I didn't think anything would happen.
Okay.
I think it's 62% saying it's going to make things worse. So, guys, you're not alone in thinking that, but I know that our aged care advocates really do make a difference, and I reflect on a case that's just been happening where we've been in there working with a provider, but also because of the older people that were there, and that one of our advocates just come back week after week and them saying, we're scared, we don't want to raise these issues.
Yep.
But she was so good, she was a dog with a bone, that she looked at all these different strategies, going to management, coming to us, going to the Aged Care Quality and Safety Commission, raising those issues separately, and also, I suppose, bringing those things together to bring pressure on the system. So those people were still protected.
Yeah.
We didn't out them.
Yeah.
We kept them safe, but by doing that and continuing the process over time, she was actually able to influence some really amazing change there. And now she goes back and the people say, oh, finally, we feel we can speak up now. So I'd encourage you guys to call 1-800-700-600, our advocate line.
Yep.
Speak to an advocate. Express your concerns. I think that's really important to actually say, I'm worried, and I don't want you to take any action at the moment. That's okay. And we'll come back and keep talking to you over time and then work out a plan of what's actually going to make a difference here. Always protecting you. I think, Pat, you can talk about how that confidentiality part of this and why it's so important. But it may not be a one-off intervention, but it will happen. Yeah.
So yes, that's the role of aged care advocates, specifically aged care recipients and consumers. We work with them, mostly carers. A lot of carers call us. Older people are often too frail or vulnerable. They don't want to make a fuss.
Yeah.
So if we work with them, it'll take a couple of calls or a visit or a meeting, and then gain that confidence and assure them that we're not going to dive in, where we offer that individual independent advocacy. And it is raising concerns. We deal with concerns. People might bring up 5 or 10 or 20 concerns, and then we might get out of that maybe one complaint.
Okay.
So that we can take that back to the care provider with their permission and help solve things. And we just reassure everyone, we don't want to make it worse either. If you think it's going to make it worse, wait a couple of weeks, wait a month. But if you don't speak up, maybe someone else will. And you would have thought, oh, I should have done something, I could have done something earlier.
We've got options and strategies. I think that's really the important.
And that's right. If someone says something earlier that's out of place, or choices aren't being met or rights, sooner the better. If anyone speaks up, industry staff or carers or the older person, contact someone, get some information about rights, and then we'll take it from there.
Yeah, beautiful. And you'll see also on the My Aged Care website, rights and responsibilities page, and it has the 14 rights very clearly documented, and also, again, links to places that may assist you, including advocacy services. So that's great. Again, that's a collegial type situation, which can only help the consumer 100%. And I just want to say to both Don and Steve, right number 12 is complain free from reprisal and to have your complaints dealt with fairly and promptly. So it's very beautifully but powerfully written that you have well within your rights to complain.
And I think that's the thing when we get to those conversations and when the advocates are sitting down acting on your behalf at your direction, they can say to providers, this is actually breaching the Charter of Aged Care Rights.
Yeah.
These people don't feel confident. We've heard that people don't feel confident or unsafe. You need to do something about that.
Yeah.
And using this, which is in regulations, legislation sort of thing, it's quite a powerful tool.
Yeah, absolutely. In fact, I've met people that actually just use the rights themselves as a communique. And it's, again... I met someone yesterday that was part of writing them, so that was, Deirdre. Hello, Deirdre. So, now, there's one here from Megan, which is actually a really common question, Megan. My provider has given me a copy of the Charter, and I'm unsure whether or not to sign it. Am I still protected if I don't? So, Megan, that is a really good question. Yeah, Pat, you're ready to rock.
Yes, you are. And it says right on the back of the page that you may sign it if you choose. So if you're older and frail and your family have told you not to sign anything because you might forget what you've signed, then you'll be anxious. You don't have to sign it, so long as you've had a conversation and the care provider signs it, a manager or even a volunteer, a staff member who you trust, sign it, and then they'll give you a copy. And it'll have their signature on it and the date. And then the service provider will keep a copy in your file. So there'll always be a copy. You can keep it wherever you like, on your fridge or in your other documents. And you can refer to that often. So you get used to it. Because it's all about you. You are the centre, and this is all about you, and it supports you through your aged care journey.
My mantra's been, the Charter is the Charter.
Charter is the Charter.
The rights are the rights. The 14 to the 14, they stand from 1 July. Just because you haven't even been given a copy of it doesn't mean that it doesn't take effect. So from 1 July, this took effect. So it's in place, it's yours. I suppose the signing does actually say, I know that I've got these rights. So it kind of almost puts people on notice to say, I know I've got these.
Yeah.
And I'm going to stand up and I'm going to ask you to respect my rights.
I tell this story a couple of times, and my parents got rails quickly with community home support, and the poor young guy that put the rails in was the provider giving the Charter of Aged Care Rights, but he didn't realise that my mother was so au fait with the Charter of Aged Care Rights that he was there for about an hour getting education. So yes, anyway, poor fellow. Alrighty, so I've now got a question which is, I think it's involved, and I thank you for this, Diana, because it needs to be addressed. I noticed there is no special entry point for all special needs groups. I am concerned about the care leavers as they are very vulnerable. So I'm going to go to Craig with this one.
Yeah, and I agree. I think that's partly one of the things with the Aged Care Navigators trial was to actually look at what is needed for different groups of people out there, and how that some of the barriers that we put up through systems, yes, with My Aged Care, with websites, those sorts of things, how do you help someone to still feel confident to engage with the system when they might have been treated badly by the system, or they may feel vulnerable to discrimination or whatever. And we're doing some work at the moment with the Alliance for Forgotten Australians, so thank you to the team out there, the people who are involved with AFA and other groups like that, because it's only from hearing their stories and hearing that, look, one person said to me, I feel I can't do this for myself. I need a navigator to help me. I can help other people, but because of my lived experience, I just can't do it for myself. So our navigators, our specialist support workers, they're out there and can be contacted to be able to help do some of that work. There needs to be more of it. There needs to be more specialised navigators for care leavers, for Forgotten Australians, for Stolen Generation. There's groups of people there that we need to do more. Some of that's coming through the trial, and we hope to see some results of that soon, and talking to government around that. I think it's important that people have multiple ways that they can engage with the system and access the aged care that they're entitled to.
Yes.
So we'll keep advocating for that at our systemic advocacy level. It's important that the system is responsive to all Australians.
Yeah.
And I think it's absolutely important to recognise that we're all learning about individual needs and how best to meet those individual needs.
OPAN is as well,
Yeah, and so I think working with organisations like OPAN, government will also learn how to, tailor specific requirements, including for care leavers, and we will continue to work with yourself, Craig and Marie, and work out how we can provide better resources through the website and support through the contact centre as well over time.
So our advocates can respond as well as the specialist support workers. We, under the National Aged Care Advocacy Program, we have the right to actually support people from special needs groups and help them to, if they're potential users of aged care. So 1800 700 600, ask them to give you some help. But we're going to continue to work towards an easier portal into the system for people. So.
And I guess any feedback as well, or thoughts that you feel that it would be,
absolutely.
The more information we have, the better we can.
What would make it better?
Yeah.
We all want to hear that.
How can we reach you?
Yeah.
Absolutely. Fantastic, Diana. Thank you very much for that, because it's a conversation that's going to continue. I think we've answered all those. Sorry, I thought I had another one. Sorry, Tom. Poor Tom. All right.
Tom under the pump, don't we?
Yes, always.
Juggling around.
Okay. So let's look at some of we've talked quickly with Megan about signing, and we've talked about the consumer is invited to sign. So record keeping, where are we supposed to keep the charter once it's signed? Yeah. Pat?
I heard Craig say yesterday that some people even send it to the department.
Yes.
Some of the providers are very, diligent. But at least you keep it on site, even digitally. You're supposed to scan them. Some people haven't got to receive them yet. There are timelines. They still have time. So if you haven't, just ask your provider about the charter. there will be a plan to get them out to you and have a chat with you, either online or Skype. You might get it in the mail first. So there's different levels of receiving these. But yes,
right.
keep a copy yourself, and your provider will keep a copy in their file.
Absolutely.
And it could be with your care plan and other things requests, maybe even your advance care directive, or the things that you want, your care in the future. So it could be a little part of your record for your care in the future and your wishes.
And I like to say, bring it out into the open. It's your shield, so keep your shield there ready. If you're getting home care or CHSP, stick it on the fridge.
Yeah.
And that way it's sort of a little reminder to yourself or to your loved one that these rights exist when these people, and I suppose it shows providers as they come through as well.
Yeah.
Hey, I know what my rights are.
Yeah. And if you are on CHSP or Commonwealth Home Support Programs, just be aware as well, you will get multiples of these, because each provider has to give you a copy and go through the rights. Isn't that right? Yeah.
That's correct. And also a reminder that all of these documents are on the website.
Yeah.
So if you're a representative or family or friend supporting a family member, you can go onto the website at any time and access these documents, and then you can see firsthand exactly what sort of conversations you'll be having with your provider and what sort of support you can expect.
Yeah, beautiful. Lots of resources there.
The other resource we've got is the OPAN Explainer video.
Oh, yeah.
So we've done
How
this
could I forget that?
we call them the sausage people. So we have the sausage people video, which does a really nice overview of the Charter of Aged Care Rights and the responsibilities under that, and from the provider's point of view, and also about the mutual respect that we need to have
about
with
to go
rights.
into.
Oh, I'm sorry,
Nice
I've jumped
segue.
ahead. Segued in.
So that's consumer responsibilities, aren't there?
There are. Okay. So, sorry, I've jumped ahead because we've done this a few times. But the Charter also doesn't have in itself responsibilities, and that was actually a really good decision, I think, because it is actually saying the rights are your rights, and it doesn't matter if you don't, in some ways, follow your responsibilities, that your rights still stand. So it was good to separate that out. But it is about, I've got rights, you've got rights, we all live in community, we need to respect each other, we need to respect staff and their safety, and there's things that we're under contract law responsible to do as well, like pay your bills. But older people have been paying bills their whole life, so I don't think it's sort of necessarily to put that right up in that charter.
Yeah.
There's other important things to say.
Yeah, treat others with respect. Respect the rights of staff. That's and the workers, I think, and particularly people that are coming into your home. And it's a dual responsibility as well. So to feel safe in your home. Pat, you've got something to say?
Yes, so the little booklet you probably will receive with your charter gives a few case studies, as Marie mentioned before, and it does talk about your rights coexist with your other rights. So your Australian citizens, or in your local council, and all those other rules and regulations and laws still go with you. These are just on top of that. And you have the responsibility to look after other people. If you're in an aged care facility, everyone has the same rights. You haven't got more rights than the person in the next room.
Yeah.
So this is when advocacy could be helpful for you. And the first one is, of course, respect for everyone. People who come into your home, the workers, the management, service providers.
Yeah,
and
culture,
aged care.
diversity.
Yes, accept you as an individual, and also accept other people without judgment.
Absolutely.
Just respect, plain respect, and then you go a long way.
Beautifully put there, Pat. Thank you. Okay, a couple more questions coming in. So, Megan, are the responsibilities of older people explicitly stated anywhere in the Charter? We kind of covered that, but...
Yeah, look, just to say, if we go to page 10 to 13, if I remember correctly, have I got it right?
Yes.
As an aged care consumer, you have responsibilities, it's outlined here. Respect, treat others with respect. Safe environment, respect the rights of staff to work in a safe environment. Information, assist your provider by giving them relevant information. That might be about your medications changing or something your GP had said, and paying your fees on time.
Yeah.
So they're in this booklet, but they were purposefully kept separate to the Charter of Rights, because it was seen that empowering and, as I said before, equaling that power differential is really important, and that's what this is doing here. Yeah.
And having that conversation, having the confidence to have a conversation, and yeah, beautiful. So another one from George. Who do I turn to if I feel one of my rights has been breached? Pat.
Well, first off, always go to your provider if you feel safe to do so, and you should by now build that trust and relationship. It should be a partnership of care and services for you. So just ask to speak to someone, say you've got a concern, or you're a bit worried, or you're not happy, whatever language is comfortable for you, and you're just talking to them and have a conversation. Or you can get a family member or your carer to sit with you, or raise concerns, or get an advocate. So again, we have aged care advocates in every state and territory. Use the OPAN number and contact someone. We will help you, give you a bit of courage to speak up, because it's not easy. None of us complain.
No. Particularly if you're vulnerable and frightened.
That's right. And you probably find the aged care provider, once you raise concern, will be very happy that you have. Then they can fix things for you. And if you're in a facility or there are other people in your service, raising that concern could improve the service for everyone. And that's how things are improving all the time, because people notice things and speak up and say, why are we doing it that way? That's, so speak up, ask for an advocate, someone to speak on your behalf.
So frontline resolve with the provider yourself. They should have told you what their complaints mechanism is and how that should work. If they haven't, ask them. The aged care advocates, 1800 700 600, and the Aged Care Quality and Safety Commission's there for you as well. So you've got a number of avenues, and you can choose to use all of them or one of them, what you feel comfortable with.
Absolutely. Fantastic. So I hope that does definitely answer your question there, George. And it is a frequent question that we get going across. At the moment, we're doing the Charter of Aged Care Rights community events, and all that is available on the OPAN website, as are all of the resources that we talk about. We're about finishing forever. Are there any parting words to our community out there?
I think we know that the aged care system is tricky to navigate. There is a lot of people working to try and smooth the journey and make it easier to understand.
Yeah.
And I think as we go through the next few years, it will hopefully get easier. But there's people out there are resources, there are people like ourselves who want to help people to understand the system and to get the best out of the system. Because going into aged care, one, you shouldn't have to check your rights at the door.
No.
And two, it should actually be a really positive experience that celebrates life and celebrates your lived experience and you as a person. So the more we can get that out of the system, the better, I think.
Lovely. Pat?
And it's important to know that you do have choices all along the way, and if you can be given some choices at least as you age, it's very empowering for older people. And there's a lot of resources, different languages. My Aged Care's got a whole lot of resources we can print out for you if you haven't got a computer. There are phone numbers you can call. You don't have to do it all by web. A lot of older people we speak to haven't got any family and they're in their 90s, so we're quite easily to download some information, print them off, send them to you. Then you can sit with your family and friends and have a chat and find out together the journey. Start the journey, because it is a journey. Yeah. And it is important that your welfare and all the aspects of who you are, no matter which aged care service you engage with and get support from, should accept you as an individual.
Fantastic.
So you shouldn't just rely on the specific Aboriginal services or culturally diverse or LGBTI. Every aged care service should accept you who you are and talk to you about what you want and your individuality within a community that you live in. We're not all the same with our wishes and desires. So, and there's always a choice. If we can help with that, just reach out to someone.
Yeah, reach out. Perfect. Alison.
And look, finally, I guess, to recognise that there are lots of people in the aged care system who are here to help you.
Yes.
So, yes, the government provides information and services through contact centres and websites, but equally we work in partnership with advocacy groups. It is independent, but it is about helping you to get the services that best meet your needs. I would say, if you have the opportunity to sit back and think about what you actually need and want, talk to trusted people, to your friends, to your family, to your GP, and work through using the information either on the website or the contact centre or through advocates, what steps are right for you. And just a reminder, on the website, the resources tab has a whole lot of information at your fingertips. All of that information can be downloaded and printed for you from the contact centre, and they can send it to you if you'd prefer not to use a website.
Beautiful. Excellent, and some fantastic parting words there. I'd like to thank you all very warmly for being on the panel today, and to everyone that's been on the panel and the people that we've met as we've been travelling across with Navigating My Aged Care. It's been a great experience, and they are all up on the website, so there to watch again and again if you want. And with that, I'm going to say goodbye. Take care, everybody, and age well and positively.
Thanks, goodbye.
Thank you.
Thank you.